Kudzai Moyo is a 46-year-old who lives in one of the suburbs on the outskirts of Harare in Zimbabwe. She is married with 3 children and has been a long-term palliative care patient first seen by the Island Hospice and Healthcare team in June 2009, complaining of chest pain as well as large sores on her legs that were septic and very painful. She was immediately commenced on a pain medication and wound dressing for the sores. She was diagnosed with pulmonary tuberculosis and was also HIV positive. Her primary caregiver was her sister. The palliative care team has continued to supply dressings for the sores which have persisted over the years. At some point, her condition deteriorated to an extent that she could not help herself even with basic activities of daily living. At this point, they moved her back to her parents' home. Her siblings helped to keep an eye on her children who remained with her husband. This was very hard for Kudzai, who had always been actively involved in the daily activities of her family. It was depressing to be so helpless and dependent, and she felt like a burden to her loved ones. The sores persisted over the years, and at some point she was referred to the opportunistic infection clinic for viral load checks. By then, her pain was well managed and under control, which reduced her distress significantly. Although the family had received counseling around cross-infection, Kudzai's husband was subsequently also diagnosed with tuberculosis and was enrolled on care by the palliative care team. This led to a lot of emotional pain for Kudzai as she grappled with the why me question that nobody could answer. She was depressed and her faith suffered a blow as she lost all motivation to go to her church, which had always been a great source of support to her and her family. However, her husband's full recovery in 2016 brought her much relief, and she reported being a lot more emotionally settled. They received further counseling and support to continue practicing safe sex. Meanwhile, her wounds took a turn for the worse. Kudzai was now convinced that she had been bewitched due to the wounds that had taken over 10 years to heal. However, the palliative care team followed up with adherence counseling and nutritional guidance, including high-protein diet. And finally, in 2019, the wounds showed some significant improvement and the pain remained under control. By the time of making this documentary, Kudzai only has very small wounds left and is not in pain as it is being well managed. So she is hopeful that the wounds will soon be a thing of the past. Thanks to the family involvement, multidisciplinary team health workers, and the community-based palliative care team that has supported her and her family over the past 13 years.
Palliative care is instrumental to improving the quality of life of patients together with their families, and this applies to both adults and children who are facing problems associated with life-threatening illnesses through the provision of holistic care. This is made possible through the Hospice and Palliative Care Association of Zimbabwe hospice members who provide community-based, family-centered palliative care to all patients. With their motto of leaving no one behind, some members of hospice focus specifically on children to ensure that they too receive the deserved palliative care.